Open enrollment for 2018 health insurance ends in 5 days. A new survey finds that insurance is about to officially become unaffordable for many. It also explains why there's such an adamant divide between those who love Obamacare and those who hate it. The survey was done by the first and largest private online health insurance marketplace, eHealth. I spoke to Senior Vice President John Desser. I remember when Obamacare first started and they had so many problems with their website. eHealth offered their expertise to help them sort through it and get things working. They didn't want the help.
It didn't seem to be that they did. We offered. I was told that a U.S. Senator at one point walked into the Roosevelt room with an iPad and pulled up our website and said, "Mr. President, here's a private health insurance website that is working. Why don't you just work with them?" And I'm told the president shrugged and looked at the staff, which I interpret to mean, I don't care if there's a private website that works, I want my website to work.
He could have meant as well, why can't our website work if theirs does?
I think that is what he meant.
You have crunched some numbers that explain a lot about why some people love Obamacare and why some people hate it. What did you find?
Well, it's really a story of two families in a sense. It explains to me a lot of why there's such passion around this issue. Because if you're fortunate enough to qualify for subsidies, you do get a lot of help and you're getting really good coverage. But if you're unfortunate enough to fall off of this, what we call a subsidy cliff, and literally that could mean earning an extra $200 per year, then you get no help.
This sounds rudimentary, but can you just say in general terms what a subsidy is? Some people on Obamacare actually get a subsidy. What does that mean?
So under the Affordable Care Act, if you earn less than 400% of what they call the federal poverty level, which is about $98,000 for a family of 4, you get help. The government will pay for a portion of your premiums, and if you're at the lower income level, closer to, let's say, 138% of poverty, they'll be paying for pretty much all of your premium.
So a lot of people under Obamacare get completely free to them health coverage, paid for in essence by other people, but some people pay a lot for the coverage they have.
That's right. If you're lower income or you had a pre-existing condition, the Affordable Care Act did great things for you. But if you're doing about average or slightly above average and you're relatively healthy, your costs went up significantly and you didn't get any help.
Where is that tipping point where if you make below a certain amount, you are being helped, but how much more do you have to make before you kind of fall off of that assistance?
For a family of 3, it's about a $200 differential. So at the $81,000 level, you'll get a decent subsidy paying for almost half your premium. But if your neighbor next door makes $200 a year more than you, he gets no help at all.
Two guys living next door to each other, one makes $400 more in an annual salary, but pays maybe $6,000 more for insurance because they make that little extra amount.
Exactly right.
The eHealth survey also finds that going into Obamacare's 5th year, health insurance is about to become unaffordable for many Americans under the law's definition of affordable.
Under the law, once you reach a certain percent of income, if the premium exceeds a certain percent of income, you're exempt from the mandate. And so we no longer consider that affordable coverage. And because of the premium increases that we've seen over the last few years, increasing percentages of families will hit that affordability threshold. They'll no longer be subject to the mandate, but they're also not going to have health insurance.
And what did you find?
That in 47 out of 50 cities, that was the case.
During campaign 2016, Desser says eHealth contributed to Hillary Clinton on a board member's recommendation, but shortly before the election also donated to Donald Trump to hedge their bets.